Hi, my name is Tom Hart from Cairns Total Physio, and today I'm going to discuss some questions that we're frequently asked in our clinics, which is, why should I tape my ankles? And then the follow-up is usually, well, how do I go about taping my ankles? So in terms of why you should tape, there's three main reasons. The first is prevention, to try and prevent that ankle injury from happening to start with. The second is if you're rehabilitating or returning to sport, just to assist with the ligament injury healing, and also to assist you in getting back to sport. And the third can be if you're experiencing any pain or instability whilst you're playing sport, taping can help in all those situations. Any sport that involves a lot of change of direction or jumping and landing or changes in impact is a sport that you should be considering to tape your ankles. These type of sports include basketball, AFL, soccer, and any of the rugby codes. In terms of what we're trying to prevent when we are taping our ankles, it's what we call an ankle inversion injury. And this sort of injury happens when your ankle rolls onto the outside border of the foot and ankle, causing damage to the ligaments on the outside of the ankle. The lateral ligaments are sort of 4 times more likely to be damaged than the medial ligaments of your ankle, and that's the reason we tape, to prevent that. In terms of preparing to tape your ankles, there's a couple of things you need to keep in mind. The first is making sure that the skin is clean and dry and free of any oils or massage cream that could affect how well the tape adheres to the skin. And the second is making sure we've got the correct tapes for the job, so your standard sort of rigid tape, and then also any sort of overwrap that can help to keep the tape on more effectively. You also need to keep in mind using foam underwrap in case the patient has any form of skin irritations. Okay, so now I'm going to demonstrate how to tape an ankle to prevent an inversion injury of your ankle. Like I said earlier, you just want to make sure that the skin is clean and dry before you start so that the tape adheres well. The first step is to make sure that the patient has their foot pulled back up towards them before we start. So the first strips we use are what we call anchor strips. So we place these sort of 5 to 6 centimetres up from the bones on either side of the ankle, and we angle them down slightly so that we don't affect circulation on the leg. So just around. I often use 2 of those just to give the next lot of tape something better to stick onto. So the second step is to use what we call stirrups, and these run from the inside of the ankle, underneath the foot, and up the outside of the ankle. Now, depending on the size of the ankle, you may need to use 2 or 3 of these. You'll just have to make that judgment depending on the size. So on this ankle, I'd probably use 2 stirrups. So the second one is just a little bit below the first one, which you'll see as we come up the outside of the ankle, just so we're covering over the bone on the outside of the ankle. So the next step then is what we call 6s and reverse 6s. So a 6 starts on the outside of the ankle, crosses over the front of the ankle, passes underneath, and then comes up the outside. So these really help to stop the ankle from rolling inwards. So again, depending on the size of the ankle, you may need to use 2 or 3 of these. First one, and the second one just starting a little bit higher up, passing underneath again, and then coming up the outside of the ankle. And then often we'll use what we call a reverse 6, which goes in the opposite direction, and this just really helps to stop the ankle from moving in either direction. So it starts on the inside of the ankle, crosses over to the outside, and comes up the inside of the foot. The next step we often use is what we call a heel lock, and this helps to really lock in, as the name suggests, your heel and the back part of your foot to stop it moving around. It can be a little bit complicated and takes a little bit of practice, but it's very effective in stabilising the foot. So if this one, we start on the outside of the ankle, near the bone on the outside, and you just angle the tape slightly so it's going underneath the foot, then it comes up the inside and wraps behind the heel and comes up to the top of the ankle, so we're halfway there. Then it crosses over the front of the ankle, passes under the foot again, around the back of the ankle, and finishes up on the other side. And And then lastly, we just lock off our anchors at the top again to make sure that the tape doesn't move. So again, this is a basic sort of ankle taping. Sometimes you can make variations with these, and it depends on the type of injury you have, and you really need to see your physiotherapist to see what you specifically need for your sport. If you have any further questions, feel free to contact us at one of our 3 clinics or at our website www.cairnstotalphysio.com.au.